What happened if an ancient baby stopped breathing? Everyone froze, because the next few moments could decide whether the baby lived or died forever. But how did ancient people even know if a newborn was truly dead? Could they bring the baby back without modern medicine, or were they already preparing for a funeral? What historians discovered is far more shocking than most people imagine. So, what was the very first thing anyone did in that silent room? They didn't panic, not visibly. Someone moved instantly, usually the midwife. But what could she actually do? With no machines, no oxygen, no modern knowledge of the lungs? She used the only tools she had, her hands, her breath, and whatever her mother and her mother's mother had passed down to her. Did these methods actually work? Sometimes, midwives would rub the baby vigorously to shock the body into responding. They'd hold the baby upside down, hoping gravity would clear its airway. Some even breathed directly into the baby's mouth, centuries before anyone called it a medical technique. But why did they believe these methods worked at all? Because every successful birth became another lesson, even if nobody understood why. But what if the baby still didn't respond? Then people turned to explanation, not treatment. In Mesopotamia, a still baby wasn't just a tragedy. It was proof that something evil had reached it first. What kind of evil? A demoness, believed to hunt newborns in the most vulnerable moment of their lives. So what did families do to fight her? They didn't fight her with medicine. They fought her with ritual, amulets, chants, figures placed near the baby's bed, meant to frighten her away before she could return. Did Egypt have a secret that other civilizations didn't? Their healers carefully recorded births, kept detailed medical writings, studied the body more closely than most. But when a newborn stopped breathing, even they had few real answers. So was it magic instead? Often, an unresponsive baby was blamed on restless spirits or curses turned against the family. Then something unbelievable appeared in Greece and Rome. A technique that almost sounds modern. Hollow reeds placed inside the throat to help air pass through. Wait, reeds? Long before ventilators existed, long before anyone understood oxygen. So did they use this on newborns? Rarely. Most of that knowledge was reserved for animals or older patients. Newborns were treated differently. How differently? One Roman-era physician described a method to judge whether a newborn was even worth trying to save. What if the baby looked too weak? Some families never even tried, because they believed survival had already been decided. Did anyone question this? Almost no one. Survival wasn't guaranteed by health. It was decided by belief. So what actually saved the babies who did make it? Sometimes skill, sometimes luck, and sometimes something people couldn't explain at all. Did people call it a miracle? Often. For most of history, if a baby who wasn't breathing suddenly gasped back to life, there was only one explanation available: divine intervention. Not biology, not oxygen, just a miracle. Did that belief ever change? Eventually. Centuries later, doctors began asking a different question. What if breath could be restored? Through technique, not prayer. And when that shift finally happened, everything about childbirth began to change. But for thousands of years before that, a baby's very first moments of life were also its most dangerous. No monitors, no warnings, just a room full of people, hoping instinct would be enough. Perhaps that's what makes this story so heartbreaking. Some babies survived, not because ancient medicine understood them, but because someone refused to stop trying. And this was only one of history's forgotten struggles.